Is put on by our caregiver support group and myself from the BRO team, which is Behavioral Recovery Outreach. Our presenters, the people that put this together is Cheyenne Frankenstein, a social worker with caregiver support. She is not able to be with us today. Annalisa Torkelson is here with me, and she will be presenting as well as me. And my name is Kim Morgan. I'm from the BRO team. For caregivers of veterans with dementia, focusing on proactive planning, navigating VA resources, and managing the emotional and practical aspects of transitioning to long-term care is our focus today. And you'll see that acronym of LTC, that means long-term care. So we know that caring for a veteran with dementia is one of the most meaningful and challenging roles a person can take on. Today's discussion is about preparing for the next stage of care in a way that protects both the veteran's safety and our caregivers' well-being. Welcome, everyone. We want to acknowledge the emotional weight of this topic, and we're thankful to you for the work you already do every day. The task before you is great, and we never take that lightly. We appreciate you so much. This presentation is not about giving up on a loved one. Planning ahead helps us to reduce stress, improve safety, and preserve dignity. You, as caregivers, are not alone. There are VA resources, support programs, and professionals available to help. Every family situation is different, and there is no perfect timeline. So, on our next slide, you'll see some of our objectives today. We're going to recognize when it's time to consider long-term care. We're going to talk about understanding the types of long-term care options available to veterans. We're going to identify VA financial and care benefits that can assist with cost, aid and attendance, our community living centers and contract nursing homes. We want to give you some information about the wisdom of preparing your legal and financial documents, having a power of attorney, and meeting with an attorney for a will. We also want to talk about managing the emotion that that all caregivers have to experience for the transition for both the veteran and yourself. So we also want to impart by the end of today, our goal is to make you feel more informed, more prepared, and more confident about the next steps available to your family. What you should watch for when home care is becoming unsafe or unsustainable. We also want to discuss the different long-term care options that we have, and then talk to you about how the VA has resources and benefits to help reduce that financial strain. We want to get ahead of the financial and legal preparation before we have a crisis. Oftentimes that's what happens is, some calamity happens and then we're faced with that decision in a rush. And we also want to talk about the emotional side of it, the things that you will go through as well, things like guilt, grief, and adjustment for both you and the veteran. And our goal always is to empower you as the caregivers to make informed, timely decisions about long-term care, utilizing the VA resources to reduce the burden and stress and help with that transition. Okay, recognizing the right time. So we look for things in our assessments of a decline in activities of daily living. So are we seeing more issues with dressing, eating, increase in falls, reluctance to take medications, wandering, anything that has to do with safety? Escalating cognitive and safety risks, just as I spoke about a second here, about the wandering, or repeated falls. We also want to look at the worsening physical health and medical needs of either the veteran or ourselves. And then look at the potential for severe caregiver burnout. If you're really struggling yourself, then that may be time, because you will not be able to be of service to the veteran if you're really struggling yourself. And so we're trying to prevent that. What do we know about dementia? We know that it's progressive and that care needs change over time. We know that needing more support does not mean that the caregiver has failed. And we also know that many caregivers wait, unfortunately, until a crisis happens before considering long-term care. Planning early gives our families more choice and less stress. So, going back to the decline in activities of daily living, the ADLs, something to look for is if they're struggling in two separate areas. So it could be difficulty bathing, dressing, or brushing teeth. Could be an increase in incontinence or an ability to use the restroom independently. And it certainly could be a significant weight loss or difficulty preparing and eating nutritious meals. When it comes to what do we see in escalating cognitive and safety risks? We see that dementia and memory loss requires a highly secure environment that standard home care or basic assisted living often cannot provide. So we'll talk about levels of care here when we come up here too on that. Warning signs include the wandering or getting lost, leaving the house unattended, or becoming disoriented in familiar places. We're going to look for dangerous behaviors. Are they forgetting to turn the stove off? Are they leaving doors unlocked? Or are they having erratic mood swings? And of course, along with some of that comes sundowning. Are they experiencing extreme agitation and confusion in the late afternoon or evening? We're also going to look at worsening physical health and medical needs. When a veteran's medical needs become too complex or unpredictable, a higher acuity environment becomes mandatory. Signs include frequent falls or balance issues. Are they having repeated hospitalizations? Are they also having severe bruises that are popping up more and more that are unexplained? Those are all red flags. We also look for complex medication management. Are they struggling to self administer medication safely, or do they need strict, continuous oversight? Some of the things that are pertain to that are sliding scale insulin or anticoagulant monitoring. Are they having advanced clinical needs? Do they require IV therapy? Do they need more physical therapy or the management of advanced stage 3 or 4 pressure ulcers? If those are occurring, those are signs that our loved one may need a higher level of care. When it comes to our caregivers, you in particular, is the primary family caregiver experiencing chronic physical exhaustion, high anxiety, or deteriorating mental health by continuing to provide care at home where it becomes unsafe for everyone? Are you experiencing chronic exhaustion as a caregiver, depression, anxiety, irritability? Are you neglecting your own medical appointments or sleep? And are you feeling overwhelmed or constantly hypervigilant or on alert? Waiting too long can result in emergency hospitalizations or unsafe situations. A planned transition is usually less traumatic than a crisis driven placement. One thing to remember on this topic, long term care should be viewed as a continuation of caring, not an end to caregiving. So, what do we have for some options here? These the community options that are non-VA that are kind of found within the tri-state region here that's common to our area are community nursing homes that are non-VA contracted by the VA. Often those might be smaller and they might be closer to your home. We also have community assisted livings that those are non-VA contracted by the VA and they're often closer to home. Um, we also have our community nursing independent living, which is non-VA it's not contracted by the VA and it's often closer to home. And then we have memory care nursing home. That is, we do have some facilities that have contract nursing home care that's a memory unit. Those are very far and few between. What's happened is after COVID, we did lose a lot of those memory units when they were taken out. We look at funding sources. What do you have to pay for that? Do you have personal assets? Do you have long-term care insurance? Do you have home equity you can use? And as a resort, you can also apply based on income for Medicaid or use Social Security to pay for that. The VA has some benefits that you can apply for through a regional office or a local veteran service officer. Those are called disability compensations, pension, and aid in attendance. And those are all assisted through a VSO or our regional office. Um, One thing to look for if you are thinking about Medicaid is you need to qualify for that based on income and that there are spend down requirements. And we just recommend that you contact the Department of Social Services to ask more information about that because they have all of the guidelines of which to follow. There are also there's impoverishment protections for you as the spouse. You're able to protect some of those assets. And again, we trust those caseworkers or case specialists at the Department of Social Services to work with you and give you that information firsthand. So you can also have a coordination of VA benefits with Medicaid and long-term care payment sources. What does it all look like for non-VA choices? Okay, so we have levels of care offered in the community centers within the states of South Dakota, Iowa, and Minnesota. So we're going to go from least restrictive up to the highest level of care. First, we've got senior apartments. And those can have add-on benefits like you can get some a la carte services where they provide some meals, or they might have some non-RN specialties like a CNA comes in and helps check on you, or somebody comes in to take vitals. They might come in to do laundry. They might come in to do some light housekeeping. So some of those examples in Sioux Falls are Washington Crossing, Sunnycrest Village, and then there are several others that have senior apartments where it's based on some of them are based on income, some of them are based on age, or some of them are based on both. You definitely will have private pay only for the most part for those. And so we just encourage, if that's an option for you based on your veterans level of care, that you access that. Then we also have places like assisted living that are private pay, and those are individual based on each location. Some accept Medicaid, and those need to be approved. You need to be approved before admission. And again, we would defer you to the Department of Long-Term Services and Supports, or DSS, because they'll assign a caseworker once an application is received, and they'll work with you on that process, start to finish. Assisted living has requirements about what they can and can't provide. And so again, the VA has not ever approved to do contract care with an assisted living. So again, that would be Medicaid, private pay, or long-term care insurance. Then we also have we have assisted living with memory care. Those units are often private pay, and those are going to be places of business in Sioux Falls like the Inn on Westport, Trail Ridge, Touchmark, Legends on Lake Lorraine. We have Edgewood Vista. And Edgewood Vista may be the one outlier that it does have some Medicaid beds available for assisted living in memory care, but it's far and few between. And again, the earlier you get an interest and a name on a waiting list, it's going to increase your chances, all the better. Then we have our nursing homes that are private pay, like they can access your Medicare benefits for Part A, and then your Part B to get therapies and stuff. You need to have a skilled need for that. So there has to be some parameters around that. I won't go too far into the weeds, but the facilities can explain that. And then if you are staying on for long-term care, they have Medicaid as a payer source unless you have long-term care insurance or private pay to remain there. We also have those nursing homes with memory care that are private pay or Medicaid, again, for a selective number of facilities across the state. Units are usually under 20 residents, and openings are sporadic. The openings are often based on a death but then again, there are wait lists, and it just gets a little bit more complicated. So earlier, the better. So, what does the VA offer? Okay, our VA has the Community Living Center. Several of you have probably had your veteran or have known someone who has used our CLCs. They are owned and operated extended care and rehabilitation units, hence CLC, Community Living Center, designed to feel like home. They're a step down from the hospital side where it's more acute, and some CLCs offer long-term placement if a veteran is 70% service connected and above. Um, we have now one floor of CLC available here, which is approximately 24 beds, and they base their admissions on acuity, and they're basically doing short-term rehab and respite care. So you do have that option to access them based on a need. Staff can put in a CLC referral, and or you can talk to your caregiver support social worker about respite care, and if that's a possibility and opening to have here at the CLC. Our state veterans homes, those are owned by the state and they're VA certified. We have one out on the west side of the state in the Rapid City area, which is a long way for Sioux Falls. So uh, unfortunately, we don't place a lot of people there because it's so far away from, where you typically call home. Minnesota has a handful of them as well, and the closest one is Laverne. There are requirements that you have connections to being in the service for that state. And so if you were enlisted in Minnesota as a veteran, you may qualify. And then again, that's based on availability. It is a very nice facility. We've been there and work with them quite a bit. We also have medical foster homes. Currently, we're, I believe, down to one, and those are private homes caregiver support, um, where a caregiver supports a small group of veterans that live there, and then they are also paid by the veteran and monitored by the VA. And then we have assisted living slash memory care, which again is not paid for by the VA, but aid and attendance benefits can offset costs. I can't stress enough the importance of talking with a VSO, a veteran service officer for your county, and or the regional office to see if the veteran qualifies for benefits. You want to make sure that you maximize everything that a person has coming to them, to get what they just deserve for the future of care. So there's no one size fits all option. We're just giving you the kind of the smorgasbord of what to choose from, and then we encourage you and your families to explore multiple settings. Go out and ask to see some of the sites by just walking in and saying you'd like a tour, calling them, talking extensively with your family about where you think would be a best fit for your loved one. So we'll go on to the next one, and Miss Annalisa is going to take this one over.
Yes, hello guys. So we are going to focus on paying for care. So we'll start with what the VA pays for. And it's really important to keep in mind, all of these are going to say co-pays may apply because a lot of what the VA pays for is based off of service connection. And then service connection is done and submitted through your VSO. So kind of like Kim was talking about, it's really important to connect with your VSO and to see what you're eligible for in terms of benefits and service connected or disability rating. Okay. So what the VA pays for: home health services. So again, based off of disability rating, what your veteran is rated at will help determine, amongst other factors, how much your copay is. And then they do pay as well, same stipulations: adult day health care, respite care, homemaker services for veterans who meet eligible criteria, community living center stays. So, like Kim was talking about, respite here at the CLC or step down from hospitalization, nursing home care. And again, this is nursing home level care, not assisted living care. So it's a key difference is if your veteran goes into an assisted living, then the VA will not cover it. It has to be that nursing home level of care. Um, and then it's at select facilities for veterans who are 70% disabled or higher, 60% plus unemployable, or for veterans who are on hospice status. Okay. So again, the nursing home care eligibility is really based off of some of those criteria, amongst others. But again, you can always talk to a VA social worker about how to arrange that or how to look into that. And then hospitalization at non-VA facilities. So VA must be notified within 72 hours. So again, copays could potentially even apply for those hospitalizations, but if you want the VA to look into seeing if you're eligible to cover that stay or a portion of the stay, anytime your veteran is hospitalized outside of the VA, making sure to contact the VA within 72 hours of admission to let them know to facilitate with that other facility, whether it be Sanford, Avera, or something else in your area. Um, and then we're going to go to what the VA does not pay for. So again, assisted living. That's a big one we always get asked about. And again, assisted living is not covered. Independent living, medical foster home, veteran must privately pay for this. And then respite, home health care, adult daycare, and homemaker services through non-VA approved vendors. So it's really important that you remember that the VA has approved vendors that we are contracted to work with and pay for if your veteran is eligible and approved. If you choose to use a vendor outside of our approved contract list, it will be private pay. And then ways to pay for care. So, of course, there's private pay. So, it's just out of your own pocket, your own assets. There's Medicaid. You must meet income requirements. And like Kim was talking about, you work with social services for that. And then we have long-term care insurance policies, aid and attendance benefits through Veterans Benefits Administration for veterans who qualify. And that aid and attendance is done through the VSO. So if you need help being connected to a VSO, we can definitely help you do that. We just cannot help you apply for those benefits. That's outside of our realm and area of expertise. And then veterans homes, more affordable options for veterans and spouses. Again, spouses could potentially be eligible based off of veterans service connection and a couple other requirements. So that is something to look into is if you qualify under your veteran to also be eligible for one of our veterans homes through the VA. So that's a good benefit if you qualify, and always make sure to talk to your VSO and social workers to see if you do. Okay, and now we're gonna kind of walk into what to start with. So this is the first steps, getting organized. So the first step is going to be gathering important documents, reviewing finances and ways to pay for care, reviewing healthcare coverage, considerations for early onset dementia, legal considerations, resources for support. So preparation is easier before a crisis happens. We encourage families to organize documents early. Missing paperwork can delay care placement or benefits. And then these are some items you may need just to have handy and readily available is your DD 214. So this is your proof of military services, and it's needed for many VA services. So that's something to discuss with your veteran on how to, if they have it, or you can discuss with us on where to go and how to get that if you don't already have it. And then financial information, so income resources, your savings and investments, insurance policies, monthly expenses, kind of understanding where you're at financially, and how much realistically you could pay out of pocket if need be per month to cover those services. And then the legal documents, usually a durable power of attorney, allows trusted individuals to make financial or healthcare decisions. And let's see here. It's best completed while the veteran can still legally participate. So that's really important. And then the advanced care directive or the living will, keep in mind that is different than the durable power of attorney. So the advanced directive and living will, that clarifies medical wishes. It helps reduce family conflict during emergencies. We encourage you to meet also with an elder law attorney if possible. We recommend creating a folder or a binder with all the key information on it. And then, in side note, for the advanced care directive, we do a couple classes every year on how to fill that out and talking through that. We have one coming up in July. So that's something to think about if you don't already have one in place and you'd like to dig further into what that is and how to complete that.
Mhm.
Okay.
All right. Well, now we'll get to kind of the bare bones of the presentation here about how do we convince our loved one to go to a nursing home. It's not like someone, like you drive by there and go, "Hey, I want to live in a nursing home." So, how are we going to do this? So, one thing we want to do is when we're dealing with someone that we're preparing them for placement and they have a diagnosis of dementia, is first of all, we want to understand and expect that there's going to be a disruption that comes along with a changing environment. So, the more we can kind of prepare for this one, the better that we'll be prepared for it. Loved ones with dementia often find changes to be upsetting. So if you have family or friends that can be of service to this project as far as the support for you, the support for the veteran, we would just ask for them to rally around you and support you with that. Um, the first thing, be patient, expect resistance, and it's okay to not tell them too far in advance, but you be starting to think, 3 to 6 months in advance. But we don't need to give them that information too early. And then we always advocate when we do a lot of our training with our staff on dementia care, we want to make sure we're reassuring and not arguing. So emphasize the importance of safety and comfort rather than the need for help, because that will be met with resistance of comments of, "I don't need any more help. I'm getting along just fine where I'm at." So let's not even set ourselves up for that. We also want to, when we do actually make that choice to choose a facility and they've accepted the veteran, the more things you can bring in of home, like familiar objects, a favorite blanket, photos, little mementos that remind them of home, the better it will be on making this transition. We also want to make sure that we're really involving the staff of that facility about who the veteran is, what are their preferences, what is their life story, what do they what brings them joy, what might set off some triggers. um, we also would encourage you to compare several facilities. So a good fit is going to depend on the veteran's personality. It's going to what his or her likes are and what the needs are, because if the medical needs are great, that can also lower the scope of who may accept the veteran. So again, going out there and seeing what they have to offer. Trust your observations and instincts during those tours. Maybe make notes of what you do like, what you have some questions on. Um, Regarding our veterans with dementia, some specific questions we would really promote as the BRO team and caregiver support is, are the staff specifically trained in dementia care? That is a key indicator. How do they respond when someone becomes agitated or they start to wander? What are the staffing to resident ratios? What are the turnover rates? And what are the nurse availabilities over the evening shifts or overnight into the daylight hours? Safety concerns. Do they have secure entrances and exits? Do they have fall prevention measures? And do they have emergency procedures in place? Also, focus on quality of life. What are the activities and social engagement that they promote and that they offer there at the facility? What are their meal options? If a person doesn't like what's offered on the meal, do they offer an alternative to that? Do they have opportunities for family involvement? How much will they want to have you included? If you want to visit daily, if you want to stay extended amounts of time during the day, if you want to take in activities with your loved one, is that all encouraged? Look for observation tips. Notice whether the residents in their care appear engaged or do they look like they're isolated. Observe how the staff speak to those residents and visit during meals and evenings if possible, because meals can be a little bit chaotic. And so you get to see how they maneuver all that and how they respond to individual needs. Evenings are when things might calm down and are quiet, but are good times just to do a little bit of a, check in and see how things are going. So remember, our key takeaway for this is you are not only choosing a facility, you're choosing a daily environment and a community for your loved one.
And this one is really focused on the caregiver self-care and emotional support. So, it's understanding that it's okay to feel that grief, that guilt, or even relief, right? And also, you may feel all of that plus some. Um, and we encourage you to, utilize respite care through the VA services. Take a break because severe caregiver burnout is also part of one of the reasons, right? Veterans do end up in a facility. And so the more breaks you take and the more you care for yourself, your mental health, your physical health, the longer realistically that veteran can stay home with you. So utilizing respite care as much as you can. And then support groups connect with others in the VA caregiver support program. So we do have two different programs for caregiver support groups. We have the dementia specific, which is really awesome because that's a group of caregivers whose veterans are specifically diagnosed with dementia. And then we have a second general caregiver support group, and that one supports caregivers whose veterans have a wide range of diagnoses, some including dementia. So we really encourage you to connect with those other caregivers and community. And then keeping your own health checkups. You cannot pour from an empty cup. So, really making sure that you are utilizing respite care and getting to your own healthcare appointments, making sure to find time for your gardening or your walks or, lunch with friends, whatever it may be that contributes to your overall health and well being. So, making sure to do that. And then one of the things we're really going to talk about is the adjustment period. It can be really hard and really emotional for everyone involved, not just the veteran who is now transitioning into the facility. Resistance is common and expected. Families should focus on reassurance instead of persuasion, like Kim was talking about. And then just reiterating some of the helpful strategies that she already talked about was avoid arguing about memory problems, using calm, simple explanations, and then focusing on comfort and safety. The familiarity portion, so bringing, those blankets, those photos, just anything to help make it feel a little bit more like home. And then supporting staff, so share life history, military background, hobbies, routines, all those things. Um, and then the caregiver role shift. So this one's really big. So families transition from full-time caregivers back into supportive loved ones. Um, and then we really encourage the families during this time to spend quality time visiting rather than managing every single task because as caregivers, you guys know your veteran, you know the routine, it's like drinking water and breathing air to you guys. You know how it's done. And honestly, you guys, probably do it better than the staff because you're so used to it. Um, Eventually, the staff will get there. You have to have trust in that. But yeah, going in and trying to transition from that, I have to do everything to my veteran to now I can enjoy my veteran's company and really moving and transitioning back to more of a partnership role. or a role that you had before if they are your parent, and really just spending time visiting. So that's really encouraged and something to just expect if the time ever comes for you. Um, and then a suggested phrase that we like to use is even though the location of care changes, the relationship and love do not change. So it's really important that we look at this transition as an extension of care, and that, it's not a failure. It's not a lack of effort or a lack of love, because it's none of those things, truly, just at some point, right? There's a reason these facilities have, so many people on staff, and it's because the needs of the veteran have risen to needing multiple hands on deck. And you as a caregiver, you're only one person. You couldn't possibly meet those needs, right? You can't have four of you in one room at a time. So again, it's just an extension of care. And then some helpful strategies and tools for self care and emotional support. Um, just understanding that it's very complex. A lot of emotions are going to come up, and they're all very normal. Whether, again, we talked about relief up there, right? Some people may say, oh, that feels icky to feel relieved that my veteran's in a home. But now I'm also sad and I'm crying because I miss them and I feel like I gave up, right? So it's very complex, but it's all very, very normal, and giving yourself grace during that period. And also grief over disease progression. That's going to be a feeling to normalize. Guilt about placement, relief from consistent caregiving responsibilities, anxiety whether you made the right decision or not. Um, and so those are all feelings that are very, very normal, that may come up for you, they may not. Um, but we encourage support systems. So again, we have our caregiver support program, we have our support groups, there's the Alzheimer's Association groups. So if this transition comes up for you and these are emotions that you're struggling with, really reaching out and finding out, how can I build a community of support around me during this time? And then we also encourage, for your own personal health, the sleep, nutrition, exercise, and then social connection matters. We're social beings. Where even if you're an introvert at some point in your day, you're meant to connect with other humans. So really making sure you find that connection piece in whatever way feels good and authentic to you. Okay. And then these are just some little tips here. So, just contact VA caregiver support with any questions or any concerns. You can also, to help navigate this situation, or really any situations that you have or concerns that come up, schedule a meeting with the VA social worker. And then, like we talked about, gathering those documents that are needed in advance and kind of prepare yourself. So you don't have to navigate this alone. Please reach out for help before a crisis develops, because Kim and I really have seen this quite a number of times. As people do not plan for this because they hope this never comes, but then a veteran's diagnosis progresses and this is needed. But by the time the family realizes and the caregiver realizes that the level of care is higher, placements are going and have a wait list for a year, 2 years out sometimes. And then, of course, we get into crisis mode, where veteran ends up consistently being admitted into the emergency room and hospitalized, and that becomes really difficult for everybody involved. Um, let's see. And then you have already done so much to support your veteran throughout their diagnosis. Planning for long-term care is not stepping away from that responsibility or that care that you're providing. It's continuing it in the safest and most sustainable way possible. Um, So let's see here. Okay, next slide is Kim.
So to recap what we've talked about today before we get to questions and answers, we really want to take a look at respecting the preferences of the veteran before they may have the propensity to lose capacity. So that's where those advanced directives and living wills come into play to try to get those completed earlier rather than later, because then we make sure that we know what was on that person's mind when they had the capacity to make those decisions. And so that will be all the better for it that way. We also want to make sure that through our preventative strategy here that we're alleviating the stressors of last minute decision making. So we're not compromised and pushed, or like Annalisa said, where someone's brought into the emergency department and it starts that emergent process to stabilize the person and discharge plan. And the choices may be very limited. People other than yourselves may be more in the decision-making role about what will happen from here on in because of just the limited choices and stuff that's in front of the discharge planners. So we want to make sure we give the power and the respect where it belongs, and that's with you and your veteran. We also know that through prevention, we're allowing ourselves to gather input from other family members. What do adult children have to say? What do siblings have to say? People that are close to the situation, close to you, close to your veteran. We also want to make sure through prevention that we're allowing enough time to contact those resources to help within the VA and within the community so that you know that you have a lot of support rallied around you way in advance. It also, through prevention, we allow ourselves time to explore of where we're going to go. What are the facilities that are a top choice where you would like to see your loved one go? And then it also allows time to be added into those wait lists if needed for facilities so that we, again, that your needs and your veterans' needs are taken into account. So these are some resources that were pulled together of assistance. Dakota at Home is a South Dakota resource that can be accessed online or by calling their 1-888 number. And they have just their finger on the pulse. They're offered through the DSS. They know what's out there. They can send you resources. They can point you in the right direction. So that's Adult Services and Aging that operates all of that. And then, your services, that you have access to in-home care if you are wanting to have people come into the home to help. You also have your assisted living facilities, nursing facility care, VA contract care, just everything of what we talked about today. For a lot of this stuff, you can apply online or call, so you do have options depending on your preferences and your comfort level. And then we would encourage you to go to the Medicare.gov online resource to look at what is offered there. Searching for nursing homes that have rehab, home health services, inpatient rehab facilities, etc., based on your location and your preference. We know we have veterans in Minnesota, South Dakota, Iowa, and Nebraska. And so there's going to be different options based on where you live. And then know that you have the VA, our social work, people that are working with you, whether it's in PACT or caregiver support or myself as the BRO team coordinator, that you have a way to get resources from us. So you call us or reach out through some avenues to get messages to us. And this is just a recap of who we are and what we do and contact to us. So if you have questions after we wrap this up, you know how to get a hold of us. And so I just want to end with this. When living with and or caring for someone, and again, I'm speaking specifically for dementia because this is what I do as the BRO team coordinator, is we work with veterans that have the diagnosis of dementia and have behaviors. But we know when we're living with those circumstances and situations, starting early for decision making helps to relieve the anxiety of the unknown. This ensures increasing choices for where the veteran receives care and a sense of peace of mind in proactively planning on behalf of your family. So again, we thank you for joining us today. We're going to turn off the recording and we open it up to you to ask us some questions.
Says take